Hi, everybody. This is Dr. Felix Liao, and welcome to tonight's presentation on dentist, how you can heal yourself by restoring the impaired mouth, airway, and sleep axis using the painless clinical epigenetic solution. Okay, it's a long topic, but there are a couple really, really important ideas. And I'm going to start by showing this graphic here and this slide here. This one really was an inspiration to me. I published this case about 2016, and it's kind of haunted me. In one way, it answered a question, why teeth grinding? Because that's been a sort of a curiosity all my career. And then on the other hand, I wanted to know what happened, okay? What took place between the left and the right? And is there something there that we can kind of utilize and extract and apply to everybody else? And the answer happily is yes. And this is now officially called epigenetics, which according to CDC is the study of how behavior and environment can affect how genes work. Okay, so this is not the result of whatever it is that I did. This is the result of gene expression. Wow, okay. Now we're entering a different realm, okay? But if we understand this, then suddenly the earth is not flat, but now it's suddenly round. So let me walk you through this. Those of you who are listening to this for the first time, how this first case got started. This is Riley, and she came in and said, I've gone through my night guard. Can you give me another one? And I said, well, you want to find the root cause or you want more of the same? She says, there's a root cause of this. Yeah, she came off braces 4 years earlier. And I told her, hey, you don't have a big anterior open bite without the tongue being here. And that if we can get you to close your lips, you could have a whole new face. She said, really? Okay, I want to go for that. Not more of the same. So we talked to her about nutrition. The left is the most expensive corporate egg I could buy in Whole Foods. The right is a backyard hen picking out its lunch under the sun in the grass. And I told her about Dr. Singh's research. It was back in 2012. And Dr. Singh had just come out with this first case that showed that in severe sleep apnea case, we can use a maxillary appliance to improve the airway by 58% in volume. Whoa, okay. So now we have a possibility to what? Regrow the airway. Okay, and get rid of airway obstruction. So this is my own wrinkle. I wanted to know what I'm treating. So this is called Schwartz model analysis. And in Riley's case, she was -3 and 2, and the maxilla and 0 on the lower. So clearly what we need to expand is what? Maxilla. Okay, you have to know what you're treating. And we did our cephalometric analysis, and we know how to make this simple. Basically, this is an architectural blueprint of this structure that is the home to the tongue. And so we can figure out what's off where and by how much in this structure. So I also did something rather unconventional at the time, which was the use of face mask. But look what happened to this posture. Okay, so the forward neck posture has a reason, and when it's straightened, it has its own reason. Okay, the body doesn't have to compensate for choked airway. So long story short, this is what she looked like 3 years later. Again, I stared at this and I said, what happened here that we can use on everybody else? Well, underneath that, what we have is a tripling of the airway volume from 7.7 to 24 cc. And we have 2.3x of her minimal cross-sectional area from 120 right here to 276 right here, okay? This means that the area that's most susceptible to collapse, as in sleep apnea, is now more than doubled. So now what we can conclude is that when the airway is impaired, there's an impaired mouth structure behind it. When the air is impaired, you're gonna have impaired sleep. So we can connect the three dots, and I coined a new term called Mouth-Airway-Sleep, or MAS axis, okay? So we now actually can enable the MAS axis when it's impaired. So now, when you do that, you can create a different outcome. She got recruited to become a part-time model. Here, what we have is a publication of this case, basically proving that sleep bruxism can be treated with a oral appliance that is different from a night guard. Okay, this is a biomimetic oral appliance therapy. But the most important thing I want to call your attention to is this first line in the abstract. Evidence suggests that sleep bruxism is centrally regulated, that means in the brain, not in the mouth, and that the highest risk factor associated with sleep bruxism is obstructive sleep apnea. So what that means to us, dentists who deal with teeth grinding, is that we need to be thinking about airway, not just night guard. Okay? The earth is no longer flat. Night guard is at best a Band-Aid, but it does not stop teeth grinding, as you can tell from these wear marks here. So what causes teeth grinding, and what's the root cause solution? Well, Riley's case showed us that if you grow the jaws and improve the airway, teeth grinding stops. Now, whether you're holistic or not, it doesn't matter. If you do implants, you need to pay attention to this. All right? How did the patient lose his tooth, and why is this implant failing? And when will this patient lose the next tooth? And will the patient be mad at you because this happened under your watch? Well, it's easy for us dentists to recommend an implant when a tooth fails. But what happens when an implant fails? What are you going to offer her? Okay. Here's an example. This patient is a nurse who faithfully carries out every recommendation the dentist recommended. This bridge wouldn't hold. And the reason? The dentist never look at the airway. This is a lot of money put into this mouth, and the bridge won't hold here. Okay, so there's a very simple rule that you need to establish the airway, alignment, breathing, circulation before dentistry. Make sure that even if you want to stay with your conventional dental practice, be sure that you look at the airway before you commit the patient to an extensive restorative treatment plan, implant or not. Otherwise, you have one angry patient and maybe a lawyer after you. Okay, so all of this is leading up to this one point I want to make. Mouth-airway-sleep axis is a new discovery for all the medical doctors and dentists worldwide, okay? Just as Newton's apple led to discovery of gravity that eventually led to space travel, this can solve many of our old problems. So I want to tell you one about dentists, okay? Here is a facial profile head posture. So why do these people have their neck forward and their head posteriorly rotated? Why are their lips apart? Because they have an airway problem. These are postures that are ready to receive CPR, except that they're standing. Okay, so U.S. Surgeon General empowers us to do this by saying oral health is more than healthy teeth. All right, there's such profound wisdom in this. Let's look at the case of another dentist. Forward neck, okay, posterior head rotation. You can see this crease here. Beautiful, clean teeth. No periodontal disease except for some gingival recession. No bleeding on probing, okay? Dentally, he's fine. Medically, he is not. Okay, so is this dental care a success or not? This is a bicuspid extraction case. He ended up with CPAP intolerance, HIO46, Broxine TMJ issues, asthma or allergy since grammar school. He lives on inhaler. He's got low back stiffness. He's got atrial fibrillation. He's got sugar addiction. And his airway is 33% for low comfort. This is no way to live, no way to work hard through life. So what is missing in our dental training? That the patient doing his part, keeping the teeth clean, still ended up having with all these issues, okay? And it's not just his issue, it's also your patient's issues, right? So this brings me to the concept of MAS, Mouth-Airway-Sleep axis, okay? The idea is called a physiological mouth, right? A mouth that is an infrastructure that works to support alignment, breathing, circulation, digestion, energy, and sleep. Now, we don't have time to talk about everything here. We're just going to talk about alignment, breathing, circulation, and sleep. So I define impaired mouth as oral structures causing diverse medical, dental, mental, and mood problems, okay? The mouth is part of the head. And when this part is not working, you can predictably suffer bruxing and pain and fatigue and hypoxia from choked airway, bar none. So until we recognize this and fix this, the patient doesn't have a shot, okay? So what's an impaired mouth syndrome looks like in your patients? They have pain. They have a bunch of dental problems, one dental trouble after another. I don't know about you. When I was doing general dentistry, and I did that for 30 years, okay? I always felt bad when the patient needed another thing after another thing after another thing under my watch when I was taking care of them. They come back and recall, oh, God, here's another problem. Well, something is missing, right? So what I didn't know at that time was that the patient was living with an impaired mouth that I didn't know how to diagnose. And here's a patient who has this airway, and that results in this dentition and this kind of suffering. And now, because you know about the impaired mouth, airway, and sleep axis, you can start healing this patient. How are patients like this? Okay, we all know about obstructive sleep apnea, a whole bunch of symptoms, medical, dental, mood, connect to a common condition. It's called a syndrome, okay? And this thing is new as of 1993. This is the seminal article, but I basically brought sleep apnea onto the medical scene, 1993. And look at this. High blood pressure is behind 40 to 60% of OSA cases, okay? So what they do is they force air for treatment under high pressure past this choke zone. Well, we have a better answer. Dr. Singh's research at University of Malaysia Dental School found that in sleep apnea patients, maxilla is 7 to 10% narrower. Doesn't take much, 10%, and you're in sleep apnea. Well, now we have an alternative. We can regrow the maxilla and replace this. And the patients are so ready for this. Every practice got CPAP patients who hate their CPAP. So as I said, I have my own idea. So I came up with this thing called a Start Thriving appliance, because literally when you put this inside in a patient's mouth, the body will start coming back to life. So this is trademarked to be an orthopedic device for redeveloping and realigning the jaws to reduce pain, teeth grinding, and TMJ dysfunction, snoring, upper airway resistance syndrome. Notice that it does not say sleep apnea. This keeps you safe within your scope of practice. You're legally sound when you do this, okay? So you don't have to step on the sleep doctors or neurologists' turf and compete with them on their terms. You are king, you're queen inside your own office, and your patient trusts you. And so now you can give them this painless solution to help grow their jaws. The appliance, when it starts, you can see that there's practically no gap. As time goes on, 1/4 of a millimeter per week in adults, 1/2 millimeter in kids, and you can see that this grows. And when it fits on the arch, it means what? The jaw has been growing. And we do that in combination with a bone building diet, which consists of green smoothies, the best of the plant kingdom that is rich in bioflavonoids, and bone broth, the best of animal kingdom. Okay, when the two of them are added together, it makes bone. The ingredients for making bone will be there. So practically, here's what happened. This is an AMD who said in my class, week 1, she looked like this. 12 months later, she looks like this. Same person. Genes got expressed more fully. That's what epigenetics is. Okay, so what did we do? Again, we use our appliance and we put her on the bone building diet. And so Dr. Sylvia said, I'm living impaired mouth syndrome right now with severe TMJ pain. And she's tried everything else, including trigger point injections, and nothing has worked. She also suffered from fatigue, bad posture that comes with dental work, working as a dentist, and teeth grinding. Long story short, here are her baseline symptoms. There are 9 of them. So dental, medical, oral, medical, mood, and medical. All right, so a mixture of symptoms using a scale of 0 to 10. So she came in baseline at 57, and fast forward 10 weeks. Her jaw pain went from 8 to 2, sleep quality 8 to 1, right hip clicking when she walks went from 6 to 0. And headache 6 to 1, and mouth breathing 8 to 2, and so on and so on and so on. Bottom line is that now we have an 81% gain in 10 weeks. Now I know of no other treatment, no drug, no surgery, no talk therapy, no whatever other therapy that's as effective as this. Here's a medical doctor, a highly skilled microsurgeon. She had acid reflux, bought herself a nice new set of teeth. She still ended up with pain. Why? Because the restorative dentists just do teeth. They're like great, wonderful, highly skilled tooth carpenters, but they have no idea how this causes that pain. So she got talked into jaw surgery. And after jaw surgery, she reached out to me because she was still in so much pain. Out of 11 baseline symptoms, her subjective units of distress was at 99. I mean, she scored a 9 on average out of 10 on every one of these 11 symptoms. Again, medical, dental, oral, medical, oral, cerebral, vagus, all of that gets better by 70% in 4 months. Nothing else, no medication, no surgery, no exercise. Here's our own, Dr. Susan. I was really stricken when I saw this. She got a whole lot younger in a real hurry, right? I still remember when she sat in my class and she was having hip pain. We gave her this construction bike right there. And then we translated that into this appliance. And then she said it's been spectacular for her shooting pain. And this is what it looks like. So, Dr. Susan, you happen to be here. You care to share your story? Live. You're muted.
Okay.
You're muted.
How about now?
Yep.
Okay.
Good.
I was saying I was really surprised too at how quickly my body adapted and made some significant changes. I was in so much pain I couldn't walk at the end of the days, and I knew that I had to do something. And it had slowly been coming on, and it got to the point where it was really affecting my life. So I went to the class, and I was always scared about walking through airports because, let's be frank, they're very far and you're carrying luggage and it's a lot on the body and you're exhausted from the travel and sitting. And I went to Washington Dulles to Dr. Liao's seminar, and on the way there, I had to stop every 20 feet or so and just sit or hit the floor and stretch my back. So I was very concerned. We went to lunch during a seminar to walk a couple of blocks to the Whole Foods. And I said, I can't walk back. I mean, I'm in too much pain. You have to come get me. That was a lunchtime. In the end, I put on the appliance, and shortly after, a couple of days later, I went to the airport to go back home. And there was such a line at the escalator in the airport, I just started taking the stairs. And I kind of got, because I was late to my flight, I got to my flight on time. And I'm like, whoa, I just walked all these stairs, and I was wearing my appliance at the airport. And I thought, this like dramatically changed my symptoms within a few days of wearing it. My sleep, my energy, but most of all, my hip pain that prevented me from enjoying my life, traveling, carrying things, walking my dogs. I had to give up ballet dancing. And I really have to say that, I went to Europe recently. I walked all through Venice. I carried my luggage. I'm going up and down stairs everywhere because Europe is all stairs. And I didn't have really any pain at all. So it really has dramatically affected my life for the better. Not to mention the fact that I'm even able to treat patients and get these types of results as well.
Yeah, thank you for sharing your story with us. There's nothing more powerful to the patient than the doctor's own healing journey. So what I love about my job is that all the women come back looking more beautiful. And all the men come back more vigorous. So here's my next example. This is a gentleman who rather not have his face shown, so we're just seeing his oral cavity and the 2 rows of teeth. On the top left, this was October 2020. We took him from here using this and this to here. Okay, so here he's ready for the end of phase 1, which is orthopedic arch development, and he's ready for phase 2. So a lot of people say, well, you can't do that in adults. All you're doing is tipping the upper posterior teeth. You're not widening the base. Well, I challenge anybody to tell me that you see tipped posterior teeth there. My criteria for finishing phase 1 is midlines on, buccal over jet, and there's room for all the teeth to line up straight. And we did it. Okay. Occlusally, he looks like this. So what you say? Well, so we increased his palatal width by 8 millimeters in the front and 6 millimeters in the back. We increased our mandible by +4. Okay. The more important part is now his posterior teeth is wide enough for on the upper for the lower to fit in. All right. So there is no compromised mandibular posture, no mandibular entrapment anymore. So when we compare the airway volume, we have a 61% gain. So this is pre-treatment, okay, 21 cc here. And post-treatment, 33.8. All right, so in the process of growing the jaw, we improved his airway, and we improved 90% of all his baseline symptoms, which included sleep apnea as witnessed by his wife, means he wake up gasping in the middle of his sleep. Teeth grinding went from 10 to 1. Witness apnea, 10 to 0. Teeth grinding and chipped teeth went from 10 to 0. So tired and anxiety, 10 to 3. Why? Because he's starting a big business. Why? I'm sorry? Did someone say something? Okay. His pain went from 10 to 2, and he wake up refreshed 0 days a week, went from 10 to 0. So the total gain is 90%. Okay. So 90% in 30 months across the board, medical, dental, mental, emotional, without using drugs, without shots, without drills, without surgery, no side effects. So medical patients have dental issues, dental patients have medical issues. And what we can now say is that the mouth, when it's structurally impaired, is responsible for, on average, 80% of all the health issues. That's really big, okay? And so we can say, we can fall back on this, I think, really important piece of research conclusion. That is, pediatric obstructive sleep apnea in non-obese children is a disorder of oral facial growth. Okay, that means that when your jaws did not grow enough, you're gonna have sleep and airway problems. Plain and simple. Except when our dental profession don't recognize this, the kids suffer and the parents pay extra costs. For example, if this teeth get these teeth, oh, you got too many teeth. So we take them out just to straighten your teeth. You completely ignore this, okay? So when you have this airway obstruction as a result of impaired mouth, airway, and sleep access, you're gonna end up with all of these problems. And when you fix the impaired mouth, you're gonna improve all these symptoms. It's that simple. And I didn't make this up. All my patients tell me this. And you can see from the case studies I've listed so far, okay? Their mood, their sleep, their dental issues, they all get better. So here is what you can do. I give them this very simple 32-item impaired mouth syndrome score sheet. On the left are all the malocclusion, impaired mouth symptoms. On the right are all the sleep apnea and metabolic disease symptoms. All right. And we connect the dots for them. So very simply, think about the number of patients you and your hygienist see per week. And think about how many crowded lower front teeth you see every week, every day. Think about teeth grinding symptoms. Think about patients with pain, patients with bicuspid extraction, CPAP intolerance, snoring, fatigue, depression, anxiety, irritability. Never mind all the metabolic diseases that belong in the medical doctor's watch. Just focus on the MAS axis that covers all these symptoms. All right. You have a whole new practice within your dental practice to uncover. So, John Parks, raise your hand. Yes, he will be your personal guide to AMD training. So, this is how you can reach him. Copy and paste this onto your chat box and reach out to him. Any questions about AMD training? We're going to cover it, and he'll help you do your ROI calculator. He can help you with accounts receivable financing. He can give you references, anything and everything you need. So here is the basic training. We have a basic training that includes 4 hands-on seminars, 2 days each, and a series of whole health videos for you to watch at home. And we also, John will also help you with the calculator on the return of your investment, ROI. So there are 2 parts to your return on investment. One part is diagnostics. So before you can treat, you had to know what's off where and how much. That's why you need diagnostic records. So if we know the number of patients you see per week, we can give you an answer. So if you're an average dentist and you see 1 patient per hour, 8 hours a day, 4 days a week, that's 32. If your hygienist also does the same, you have 128 patients per week between you. Translated in a year later, you have $134,000 just waiting for you to do the airway diagnostic records. Now comes the treatment. Some percentage of them want you to treat them. Okay, so whether it's 10%, which is super conservative, 10% of eligible cases, okay? In the case of Dr. Susan, she achieved a 6.5x in the first 6 months. That's on seeing patients 2 days a week. I think that's really remarkable.
2 days a month. 2 days a month.
Oh, yeah. 2 days a month. Thank you. 2 days a month. Yeah, that is really remarkable, right? Yeah. So, yeah. Thank you for correcting that. I even, that is kind of hard to believe. This is Dr. Jeff Yali. He's brilliant because he appointed Brittany here and delegated the airway diagnostic work to her as airway treatment coordinator. Just like an oral surgeon who's got an implant treatment coordinator, this is an airway treatment coordinator, okay? So there's not a week that go by that I don't get 2 or 3 cases from Brittany now. So Jeff, raise your hand. Yeah, really smart cookie. And look what they've achieved, okay? Just today, Dr. Jeff said that they've had 47 cases and 5 cases are waiting. So to simplify the math, I just kind of assumed that the other 5 cases are going to go ahead because Brittany had emailed me and said, hey, get this back to us. Patient accepted treatment. Okay.
Yeah.
So that's how I know. So here's the math. 52 cases in 10 months. Okay. Roughly 5 cases a month, more than 1 a week. Okay. 26 cases started. That means the patient are so ready for this. There's a 50% acceptance rate. Okay. And when you do the math, the combined income so far is $184,000, and that's 10x, assuming that the tuition is $18,000. Okay. So, Jeff, would you want to tell us, this is indeed what you tell me?
Yeah, no, that is exact. What? Hold on, am I muted?
No, you're good.
No, you're good.
Oh,
You're
okay.
good.
Yeah. Oh, okay. All right, cool. Yeah, no, that's exactly it. And yeah, and I mean, I tried to be honestly a little conservative in those numbers. So we track it pretty accurately, but yeah, it's been there. And definitely, like when I first got started, my treatment acceptance wasn't as good, and now it's gotten a lot better. But that was after the first few months, so yeah, it's been hugely amazing. And I mean, for me, honestly, and this is, I feel like probably a lot of people coming into majors, bringing my team to the training was absolutely essential. Like there's no way we would be this busy without it, so yeah, we're actually looking at hiring another person on for Airway because Brittany's so busy and needs like people underneath her now. Yeah,
what a great problem to have, right?
Yeah, it's been really great, and it's just been great to get like these complex cases that they want to start restoratively wise. Like we're just doing what Dr. Liao kind of mentioned. We're starting with this first, and it's just it's great to see patients kind of come through that thing that they might be coming in for a couple implants, but then we get them into Airway, and yeah, we're pushing the implants off 3 years, but we're going to set it up, and it's going to be so much more successful because. Yeah, people hate failed implants. So
the implants are still going to be there for you.
Yeah, they'll still be there. But yeah, no, it's been an amazing journey so far.
Yeah. So part of Dr. Jeff's genius is one, he brought his entire team, and two, he appointed Brittany as the airway treatment coordinator, and he just lets her interact with the patients, work them up, talk to them, and all he does is comes in and nods and say, yeah, go ahead. Brittany is right, just like the hygienist says. And boom, off you go. And, and another part of his genius is he just said, hey, look, let's just send a case for mentoring and would provide them with all the talking points, what to disclose to the patient up front, how to manage expectations, how to estimate how difficult this case is, what's a reasonable case fee. So talk about patient acceptance, Jeff. How do you receive this?
Yeah, people are receiving it, extremely well. Yeah, no, it's it's kind of running itself right now. It's getting like easier and easier and easier.
Yeah.
Honestly, because it started off like me and Brittany would do the consults together and get in there, and we've kind of like slowly pared it back to where Brittany gives all of the education on why they're running into this. So like impaired mouth syndrome, just all the cofactors, and I come in and say, yeah, this is what we recommend for treatment, and then I literally walk out and Brittany goes over finances and they sign up. But also, the other aspect is like, she came from the assisting world, right? And she's just so jazzed up about this. Like she loves it, and she'll send me like things and articles on it. Like she is really like ignited a passion in her. And, I think for a lot of times that gets thrown aside. So yeah, she's super jazzed up about this whole thing. So yeah, it's fun.
It's a gift. And so thank you for being a shining example of what the possibility is. What I want to basically say to you is this, that your patients are way, way ready for you. Most dentists don't realize that the patients are ready for a solution. They just don't know that the answer is out there. So you become the answer. So let me tell you a few quick cases, then we'll wrap up. Thank you for all these incredibly revealing experience that you've had so far. So we now know that MAS is a real thing. You've got impaired mouth, you got impaired airway, you got impaired sleep. And you also will have pain, okay? And so we now have a way to enable this. So the rest of these slides are gonna run more like movies. So if you have these pains, and which dentist does not? It's very likely because when you were a kid, nobody made the diagnosis. Well, here's one of us, fellow dentists. When you have one quick look at her, you say, God, what's wrong with this person? Nothing can possibly be wrong, right? Well, she's got impaired mouth syndrome, okay? She's got this fusion in L4-5 at S1 on the left side. And so she's got limited hip rotation. So her long axis is a little off. And here's a case of gorgeous teeth and miserable owner, okay? I mean, how do you find fault with that set of teeth? Well, there's this thing called hypothyroid tongue. This is an 8-foot tiger in a 3-foot cage, not because the jaw is off, but because the tongue is off endocrinologically. So when your body temperature is low, everything in your body is affected, okay? So she has cold hands and feet and Raynaud's. And her senior associate, her employer doctor, was in my class. And then when she saw the slide, the light bulb went off in her head and said, oh, Dr. Emily, the junior associate, has been having miscarriages, and we have her permission to share her story with you because she wants the whole world to know, okay, that hypothyroidism plus an impaired airway means the child cannot possibly survive. So this was made, and nasal obstruction was treated. Guess what? These are breast milk that she pumped under this jacket while she sat in my class. Okay. So in 6 months' time, her airway volume more than doubled. Okay. And her minimal cross-sectional area nearly tripled. This is how the new life comes in, okay? And so now, there's a happy ending. In the interest of time, I'm not gonna play this video. I have a picture later on at the end. But for men, snoring and ED go hand in hand with sleep test. By the time they get to a sleep test, 2/3 of them have ED. European Urology Journal has an article way back in, I don't know, 2002, 2003. Most cases of ED recognize a vascular etiology, all right? I would add that this vascular etiology has got hypoxia that's rooted in a choked airway, an impaired mouth airway sleep axis, okay? So again, in the interest of time, I won't play this video, but basically he says that he's getting morning erections, and he says that during football games on TV, they're advertising the wrong things. They should be advertising this, okay? Well, here's what happens, okay? We're able to double the minimal cross-sectional area in this patient, okay? We went exactly from 122.5 square millimeters to 225.9 square millimeters. 28 months, double the minimal cross-sectional area. Children, this is where I love the most. This is the most gratifying part for me. This is my granddaughter, for whom I wrote that book to share with everybody. Father's chef, my son, and this is good epigenetics, okay? Behavior and environment produces wonderful human beings, okay? No appliances needed. How did our ancestors get us here? It's not because of Blue Cross or CVS or oral appliances. It's because of physiology. All right. And that's what epigenetics produce, is restoring normal physiology. That requires a maxilla that's fully developed. And that's done again with bone building ingredients. And when you do that, you get this. Baseline, she has got all these symptoms, and just a typical teenager situation. In fact, she's better than most teenagers because the mother is a naturopath. We did our homework. Look at this. The maxilla is 5, the mandible is 7. The opposite of what it should be. Okay. So on the left is right at the time when the braces came off, because mom saw the light, read the book, Your Child's Best Face. And we started this treatment. This is what it looks like 11 months later. No braces. 2 years later, we have practically 100% gain in the minimal cross-section area, from 195.7 to 389.1. Okay. So what you say? Well, we gained her 80% of her symptoms improvement. She became a national champion in speech and debate competition for all the homeschool children. Okay, so this helps, this mouth, new mouth, helps in airway and sleep and brain performance. So look at the number of medals and trophies she's won. Okay, so we don't just enable MAS, we enable full genetic potential. So this is Chinese. It basically says that when you have full genetic potential done here, you have full genetic potential in life. Super achiever, okay? So all of this is done without having to bend over a patient for a living. There are no aches and no pains. If I had to double my production, I don't hurt twice as much. Jeff, do you? Dumb question, right? Okay, in the process, you get to heal yourself. I more than double my own airway at the age of 67. And that's because the spot we occupy in healthcare is the top of the totem pole. This is not Felix Liao talking, this is Paul Chek, okay? He is an expert in the bodywork world. So, impaired mouth syndrome, once you recognize that impaired mouth could affect your airway and the sleep, now we can reverse that. It's that simple. And when you do that, all the women come back looking more beautiful without braces. Between the left and the right, she gave birth to a baby. Now, that's not supposed to happen. You're not supposed to look better after you give birth to a baby. She, too, gave birth to a baby. No braces in between, okay? There's a lawyer with bicuspid extractions. 1 year later, look at her profile. She's out dating again. She developed the confidence to just go through her divorce, and she's enjoying herself in the dating world. So clinical epigenetics, we now know how to simplify it to make the difference. First, starting to heal yourself, and 2, bring out the kid's best face, and do all of that without pain, drugs, by restoring natural physiology. And your ROI is assured, for sure, okay? So I love this. I used to dislike fixing kids' teeth. I mean, who enjoys giving a shot to a child, right? Well, here, I never have to do anything like that, just an oral appliance. Everything I do is outside the mouth, except for fitting the appliance. And you get to produce this kind of result. No pain, no drugs, no side effects, except positive ones. When you get the maxilla right, the rest of the body is right. So the road forks here. You can keep going the same old way, or you can do the new way. And the new way can lead to this. This is Dr. Emily. I just saw her last Friday. There's a happy family, okay? And healthy baby boy. And to me, it is a priceless reward of becoming an AMD. And you can do this not only with new babies, you can do this with, old men and old ladies who suffering a lifetime of pain and fatigue. You can bring them back to life. So if you're interested in doing something like this, I highly recommend you reach out to John, who will help answer every question you ever have so that you can get comfortable getting trained. And here's how to reach me if you still want to do that. So with that, I thank you for your attention and your attendance. And feel free to ask any questions, either reaching out to me or to John. Any closing comments?
Why aren't more doctors doing that? I don't know.
I'm sorry, say that again.
I said, why are more dentists and doctors, more aware of this?
Well, we inherit something from the dental school. We inherit something from our training process. Like, what's our dental licensing exam consists of, and what is our dental insurance do to limit us to just fixing teeth? Okay, so your reimbursement code determines to a large extent what you do to make money. But I'm telling you that from your own examples, Dr. Susie and Dr. Jeff, that your patients are way more ready than the dentists are. The dentists, are just, they have this blinders on, and my job tonight with this webinar and with your experience and shining example of success is to widen your viewfinder to see the whole person, head to feet, birth to now, and identify the choke zone, the impaired mouth, airway, sleep access, and bring the epigenetic solutions to them. And when you do that, this is absolutely hands down easy. So I'm grateful that you showed up and shared your experience with us. Dr. Susie, at 2 days a month, amazing. All right. So 2 days a month, we need to multiply this by on full-time standards 8x. So you have a 50x achievement. Okay, amazing. All right.
I think I need to add more days at that office.
There you go. See, yeah, Dr. Yelly needs more staff, and you need more days. I mean, the whole world is just literally waiting for the AMD to show up and deliver the solution. And in the process, feel fulfilled professionally and get rewarded financially. And in the process, you get to heal yourself, live longer, be able to renew yourself with less aches and pains and much higher quality of life. All right, with that, I'll bring this to a close. Thank you for attending, and I'll see you down the road.
Thank
Bye
you.
now.
Thank you.